Caption closed Tehran, Iran, AP, in a square in a poor eastern Tehran neighborhood known for its drug addicts and dealers, psychologist Atef Azimi draws another drop of blood from a worried passerby's finger. She works on a nearby bench, where a sign next to her in English and in Farsi urges the public to receive free voluntary counseling and HIV testing. But her worries, as well as those of her aid group called Reviving Values, are not confined these days just to those sharing needles to inject heroin that comes across the border from Afghanistan's thriving opium trade. Iran has seen a surge in the number of HIV infections spread by sex, especially among its youth. What's more, authorities say many have no idea that they are infected. That has led to growing uncomfortable questions in the Islamic Republic, where sex outside of marriage is prohibited and those who practice it can face arrest and severe punishment. Some have dared challenge the long-standing taboos in Iran surrounding sex, speaking publicly about the need for safe sex, sex education and regular HIV testing. Everybody has a very bad attitude toward this disease, said Mahbouba Zianali, an HIV-positive woman living in Tehran. They even think if they wash their hand where I do they can be infected, but they can't. According to government estimates, 66,000 people out of Iran's 80 million people have HIV, though about 30,000 of them have no idea they have the virus. Iranian authorities blame that on how little general knowledge many have about the virus. By comparison, in the United States, government statistics suggest 1.1 million people live with HIV, with 1 in 7 not knowing it. More than 50% of those with HIV in Iran are between 21 and 35, said Parvin Afsa Kazirauni, the head of the Health Ministry's AIDS department. That's despite that age group representing about 28% of Iran's population as a whole. The number of those infected through sex continues to rise. If we look at 5 or 6 years ago, the rate of infection through sex was around 16 or 17%, to 20% at the most. Now it is up to 40% or even more in some provinces. Drive. Mohammad Mahdi Ghuria, Iran's deputy health minister, told the Associated Press. This is an alert for us, the people and the officials. They are addressing this issue very seriously. Societal mores play a part in the rise of HIV infections. As a Muslim country, Iranian clerics preach against sex outside of marriage and sex isn't often discussed among children and parents. Schools offer little sexual education as well. Sex outside of marriage is illegal, and some have been prosecuted for merely shaking hands with a member of the opposite sex under Iran's strict interpretation of Islamic law, or Sharia. However, police rarely interfere with young couples in Tehran walking hand in hand and whispering to each other. The government blames drugs in part for the increase in HIV infections, though not those narcotics that are injected with a needle. Ecstasy drugs, synthetic addictive drugs and amphetamine combinations dramatically and abnormally raise sexual desire, Ghuria said. Views on sex are also changing in Iran.